ideal lipodissolve candidate is usually someone that's within 10 to up to 30% of their ideal body weight. They're not looking for a large correction, but it's just certain areas that they're having problems with.
We recommend at least 4 treatments to get the desired results. It can help in some of those troubled areas that don't necessarily need liposuction procedure.
Although lipodissolve is not FDA approved, it has been used successfully since 2004 with no serious side effects reported.
For someone who trained in traditional laser treatment, where you're trying to lay down a certain amount of laser energy in a given area of skin and do that uniformly, I think it's a lot easier to do it uniformly with the Velashape. Velashape, the Alma laser techniques accent. Some of those technologies use multiple different types of energy to create the same kind of effect, basically heating the skin, the dermis, the adipose tissue or the fat tissue, to try to create shrinkage or create injury to the fat cells so that with wound healing you lessen the amount of fat that's there. They will use techniques that combine light energy, radiofrequency energy, and vacuum suction. The vacuum suction really pulls the skin into a configuration in which they can apply the light and the radiofrequency in a more reliable manner.
The physician who was training me, my supervising physician, my teacher, my mentor, was doing the procedure with tumescent anesthesia, which is a word to describe the technique that was developed by a dermatologist, Dr. Jeffrey Klein. The benefit of the tumescent anesthesia is to offer a local anesthetic effect, and in addition there's adrenaline or epinephrine which causes vasoconstriction, or that the small blood vessels will constrict or clamp down, which subsequently leads to less bleeding, which is very important because initially plastic surgeons and dermatologists, other cosmetic surgeons that would do this procedure were doing what they call the dry technique.
I absolutely love my results. I came into it wanting to have better self-esteem. Since it was local anesthetic, I was able to watch that, and that's what made me feel so comfortable, was the fact that, you know, I'm able to see what's going on. I feel completely comfortable with all the staff. They care. You can tell that they care. And that made me really comfortable with the situation. I was back to work 3 days after the surgery. I think it went a lot better than I expected. I was expecting a whole week of pain, and it actually was only probably about 3 days. And I feel truly better about myself, and that's what matters most.